Alright, today we're going to be talking about cranial nerve testing. Principle here is that this is going to be a screen more than an examination. Now there's going to be some crossover between the two, but the principle is that we're not looking to diagnose with this test. We're looking to see if there should be further testing, or if they're safe to proceed. We're not dealing with a cranial nerve issue. But knowing there's a cranial nerve issue and figuring out exactly what the cranial nerve issue are two different things. So some of these, there are further testing that we can do besides these, but these will let us know if there's a cranial nerve issue at hand. So the first one I like to do is Optic. So in questioning, we should be asking if there have been any visual changes. One of the tests for this is the Snellen chart. But if they say, yeah, my vision hasn't changed, if they should be able to pick up on that. And then the other way is I like to test the periphery. Now some of this depends on how long your arms are, if you can leave their peripheral field. What I do is I stand right in front of them and I say, look at my nose. Obviously during COVID we're wearing masks, I say where my nose normally would be. Don't move your head and tell me which finger is moving. Very good. So if they can see that, they have a good peripheral. So that way they're looking at my nose, because if they're just turning their eyes, that's not telling me about their periphery. The next one is, which has C2 and C3, is I use my phone with a light there. Now, a key to do this well is to cover this eye for a little bit of time, about 10 seconds or so, but you want to get a good coverage of it. You can't just have it kind of dark. The darker the better. And then I shine it right in their eye. And you want to watch both pupils, because there's a consensual response on the opposite side. And I'll do the same thing over here. Because with unilateral lesions, depending on C2 or C3, could be different. And since I've touched my phone, I want to sanitize my hands. So I grab a little sanitizer. It's nice for them to see as well, since I'm going to be touching their face. And now I say, can you smell the sanitizer?
Yeah.
Very good. Now what we're going to be doing is I'm going to have them follow my finger. And the key here is not to do it too quick. If you get through there and, oh, I think it was all right, thinking it's all right is not good enough. And you want to be able to hold at the edges. So Logan, follow my finger here with your eyes, not your head. I go forward, so straight to them and out. I go to the side. You can't see me there, so I go at the side and I hold it there. I go up and I hold. I go down and I hold. And then I come all the way over here. I want to make sure he's good at all the angles. And while I hold it there, if we're just going like this and see if they can, then if there's any blips, it's hard to notice. You want to make sure that they can hold it there. And then I want to see trigeminal nerve. There's a sensory component. Remember, we have V1, V2, V3, and also a motor component. So first say, does that feel the same and equal on each side?
Yeah.
And I should have an idea, with the previous exams today, are they having any facial sensory changes? Where are their symptoms? And then I'll palpate right here. I'll say, can you clench down your teeth? Make sure they both pop out evenly. And then we're also going to be doing, so facial nerve, a lot of times we say smile, but if there's any deviations, what does that mean? It's much easier to say puff out your cheeks. And then if they let any air slip, it's like in a Bell's palsy this will occur. Air slips out and they have a tough time doing it. You can rest there. Obviously, first I'm looking at their face. Does anything look a little bit different? Does anything sound different with the way it's all being taken into account? With 8, remember we have a vestibular portion and the cochlear portion. For the cochlear, I'm going to say, look at me. No, I say, close your eyes, or I step behind them, and I rustle my fingers. I say, tell me which one. So close your eyes. Tell me which ear you hear this. You want to be 5 centimeters away.
Right. Left.
Very good. You can open your eyes. If they've not had any reports of dizziness, I'm not testing that. If they have, then I'm going to test it. First, I'd start with the Romberg, where they just stand up, and they hold their arms out or up like this, and have them stand there. We can also do Dick's Hallpike. Remember, the dizziness, there's a lot of other reasons that it could be there as well. Same with the hearing. But that may not be something they picked up on. But if they have had any changes in hearing, it may be cranial nerve, it may not be. It may be an ear issue, right? And then 9 through 12. These are really important to be pretty detailed with, because a lot of your vascular issues are going to affect the 9 through 12 because of where the vessels come in contact, are very close in contact. Any aneurysms can affect those, and that's where you get some of the palsies. So with this, we want to make sure that we look at the back of their uvula carefully. So I put on a glove. To be able to do this, you can also use a tongue depressor. We use gloves for a lot of things, so these are always handy. If you can also make sure tongue depressors are handy, that's great as well. But I'm going to have you open your mouth and then stick your tongue out. So remember 12 is we watch if there's any deviation of the tongue. That looks good. And can I see the back? Sometimes they'll have a tough time depending on their tongue position. Can you see the back? And if you can't, don't just be like, okay, that's all right. No, let's look at it. So you can just depress the tongue just a little bit. And then you want to test the palate. The palate is 9 and 10 with the sensory and the motor components. If it's deviated, we don't need to do any more testing, but there could be a number of other reasons. That's a higher likelihood that there's a problem there. Then you want to touch each side of the palate, or of the uvula there, or up along the palate. I like just to go for the uvula to see if there's a gag reflex. And remember, this could be a unilateral issue. And again, how often do we do this? It depends on how likelihood there is something occurring. If we're quite concerned about them, then we need to be a little bit more detailed, especially if their voice sounds raspy. Is that just the way their voice is or not? If they've had any difficulty swallowing, higher likelihood. Let's say if the swallowing could be from this. Am I going to go back and gag them every single time? I don't. But if they don't have any reports of, if they say, yeah, I gagged last night when I brushed my teeth, or if I gag all the time, I haven't had any difficulty speaking or swallowing, I'm going to look, but I may not do this more uncomfortable one. But here for the video, we will. So open your mouth. Nice touch on the left side of the uvula. He doesn't like that. And then on the right side there as well. And he is A-okay. The only one we haven't tested now is 11. So we want to do the accessory nerve. We want to go like this. Don't let me push down. And you want to push hard, because this one is a strong one, and it's not just innervated by cranial nerve 11. So you want to push hard if there is symptoms allowed. Now there's other reasons that could be sensitive and not have it be a cranial nerve issue. If that's weak, it still may not be a cranial nerve issue. That's when you want to test strength of cervical rotation for C3 or C4, that particularly C4 innervates there. So that's cranial nerve testing. Again, you want to be detailed. It should be reproducible. If you get it once but not any other times, then it was just a fluke finding. But in that exam, now maybe if it's different the next time, then maybe there was a change. That's why you want to make sure it's reproducible once. You can hit it multiple times, and then if it's different the next time, then there's been a change. Now if that's a bad change, that's not a good sign. If it's improving, that is a good sign. And that's it for cranial nerve testing.